So we are here at ASAP's 2019 with Dr. Eisemann, and we're going to ask him a couple questions.
Hello, how are you?
Good, how are you doing?
Good. Well, I'm a plastic surgeon. I'm a board-certified plastic surgeon in 3 specialties: plastic surgery, general plastic surgery, and head and neck surgery.
Okay.
And practiced for over 20 years. And I'm here in New Orleans. Actually came a day earlier.
Okay.
The first day actually was about a special area of interest of mine, which is rhinoplasty, which is nasal surgery, which is functional and aesthetic nasal surgery.
Okay.
And there are people all over the world who are coming to this meeting, and I want to make sure that I'm up to par and doing everything. And I think it's very reaffirming, the meeting. So all these people from around the world are doing this operation, but my results are as good, if not better, than theirs. So it's very nice to know that. But I am doing a different technique that many of them are doing, which is a technique which I learned many years ago, which is a closed rhinoplasty, which avoids the need for any external incisions. So the typical technique which is taught nowadays, which I do teach to residents also, where an incision is made in the columella of the nose, the skin is peeled back, and then an operation is done from above, and everything is visualized, but the operation can be done closed where that external incision is avoided, and it avoids making an incision, and of course the healing is better and its recovery is faster. So that's another aspect of it, I think, which has a certain appeal to a lot of patients, not knowing that they're going to have a scar. No one wants a scar in their face.
No, no one does. Have you talked to any other doctors about this? Is it a conversation topic
well,
for
it's
you?
I have talked about it. The meeting was very interesting. It's the rhinoplasty meeting is well known. I think it's over 10 years now they've been having it, and they have it every year. Usually a day before this meeting starts. But it's a very, very interesting meeting, and it's very ecumenical. It's from all around the world, different techniques that are used, and that's one of the operations which is probably the most challenging, actually, of any plastic surgery operation. So
really? I didn't know that.
Yeah, it is. It's very...
what makes it so challenging?
Well, it's complicated because it's healing in 3 dimensions.
Okay.
So it's not just healing in a certain level plane, but also in the 3rd dimension, and you're dealing with bone, cartilage, and skin, and they all heal differentially and differently, and sometimes unpredictably. So you have to kind of anticipate what's going to happen after you've done the operation, days, months, and years later, not necessarily what's on the table. So it's a complicated operation, challenging, and you have to be really committed to it. It's kind of like a book that I read called Outliners by Malcolm Gladwell. It's called Outliners, and it was the what's successful, what makes a successful person. And his contention was that you had to do something 1,000 times of anything before you became good at it.
Yeah.
And that's kind of what this is about too. You really have to be committed to it and willing to do this operation and suffer a little bit with it too, and learn from your mistakes. And it takes a long time, and doing a lot of cases.
You said you 20 years? Is that what it is?
Over 20 years.
Over 20 years.
Over
wow.
20 years. And I teach the subject too. I teach residents in 2 different residency programs, one at Baylor and also one at Methodist Hospital.
How many procedures do you think you've done?
Probably over 2,000 of this particular operation.
So you doubled what they said in the book.
Yeah, at least.
You just wanted to be
but it's
overachiever over
But
here.
it's a fun operation, and it's challenging, and what makes it interesting.
That's great.
You're never doing the same thing twice.
It's so interesting. I didn't even know that. It's good. I'm sure a lot of people are learning that that's one of the more complicated procedures.
It is.
And
It
why.
really is. It's a challenging operation, and it involves, it's not only aesthetics, but also functional aspects of it. Some people are coming in, they can't breathe, or they have headaches, or they have functional problems, and some people are coming in just for aesthetic reasons, and they overlap, and you have to be able to do both.
What would you say the percentage is of aesthetic versus
Well, in my practice, it's a little different because I'm board certified in ear, nose, and throat, as well as in general and aesthetic facial plastic surgery. So mine's about 50-50. So it's about half, yeah. So I've seen from both aspects of it. But many of the people come in for functional reasons, and they said, well, can you do this also at the same time? And we're able to accommodate them.
That's what I was going to ask next. Is so that's how generally how it goes. They come in for functional reasons. They say, hey, well, you're in there.
Or some people come in, they come in for aesthetic reasons, and when you query them about your symptoms, they have, oh yeah, I have problems with difficulty breathing, and I have headaches, or I have other problems that I can't sleep at night, or I snore, or have other problems like that.
That would be a great surprise. You go in just to get something
Oh, yeah.
aesthetically fixed, and all of a sudden you come out and you didn't even realize you couldn't breathe, or you didn't realize you're having sleeping
It's not
problems
unlike
before.
someone will come in for a breast augmentation and they'll have a tummy tuck at the same time too. So plastic surgery is from head to toe.
Yeah. Well, if you go in for, let's say, an eye procedure, you expect to see better at the end, but
You hope to see as well as
Yeah,
you saw as you go
at
in
least
and
as
come
well.
out. Exactly. You certainly don't want to be worse. But talking about eyes, they have a very interesting, one of the things at this meeting which was kind of interesting, which was about brow lifts. And it was a technique which actually I perfected and actually published.
Interesting.
And I see it now being popularized, which is a dual plane brow lift where we're making a small incision in the temporal hairline and raising the brow by two planes, and it doesn't involve any injury to the nerves. So typically when you start making incisions in the forehead, people have dysesthesia or numbness or kind of a creepy sensation, and this avoids that. So it's a two-plane operation which involves a subcutaneous dissection and also a subperiosteal dissection, which is on the bone, and we're able to raise the brow predictably, which has been a problem in the past where you think you're raising it and it falls.
how does one go about writing a book, deciding that they're going to be the authority on this procedure and writing a book?
I think you have to really want to write a book.
Well, there's that, yeah.
A lot of people have assumed amassed a number of cases about it, but a book is another whole level.
Okay.
I think you really have to want to do that.
Yeah. It's one thing to know
But
something.
you certainly have
good.
to know what you're talking about, but you have to really want to. Yeah, there's a lot involved in publishing and producing and editing. There's more to that. You have to really like that.
You seem like a pretty smart guy and dedicated too, so.
Yeah, but we're having, as far as our practice is concerned, which is kind of new, our family is sort of multi-generational doctors.
Mhm.
My father was a doctor, and now I'm having a son who's joining my practice as a plastic surgeon. His area of interest is craniofacial surgery,
Okay.
and so he'll be adding another dimension to that.
Oh, that's awesome.
And I started doing that also when I started practice, having trained part of the time in Basel, Switzerland, and also Toronto. After I finished 2 residencies at Johns Hopkins and also at Baylor. But he's finishing his craniofacial residency and fellowship at NYU in New York City, and so he'll be joining me actually in a couple of months. So
Congratulations,
we're
that's
kind
great.
of
That's
we're
gonna
kind
be
of
fun.
priming him now, getting charged up.
That's
So
awesome.
he's looking forward to that.
Well, congratulations, and thanks
Good.
for sitting down
Good.
with me today.
Great.
Appreciate it.